Our top story this morning, more countries are seeing infections of the Indian variant of COVID-19. Alongside Germany, France has placed higher restrictions on travelers from the UK due to a rise in cases of the Indian variant there. Meanwhile, Brazil has also identified its first Indian variant case. Seung-jae has our top story.
British travelers may face stricter restrictions when traveling to France due to a large number of Indian variant cases being detected in the UK. According to France's foreign minister, while the UK will not end up in the highest red list category, it may face slightly tougher sanitary measures, potentially having a category of its own. Currently, British travelers to France must provide a negative PCR test 72 hours before arrival, fill a health declaration that places them into self-quarantine for 7 days before taking another PCR test. The Indian variant has already become the dominant strain in some parts of the UK, with a 160% increase in cases over the past week. As of last week, Public Health England said 3,424 cases of the variant had been reported. In Brazil, the country reported its first case of the Indian variant on Wednesday from a traveler arriving in the country. This is stoking concerns that the variant could further fuel the pandemic in one of the hardest hit countries in the world. Sao Paulo health authorities have requested a complete list of the passengers on the flight coming from India, as well as a full list of anyone who may have come into contact with the infected passenger. The South American nation has already lost more than 450,000 lives to COVID-19 and continues to struggle to contain its homegrown variant. The WHO's weekly epidemiological update showed on Wednesday that the Indian variant has now been officially recorded in 53 territories. However, the WHO also received information from unofficial sources that the variant has been found in 7 other territories, potentially raising the total to 60. The WHO added the variant shows increased transmissibility, but disease severity and risk of infection remain under investigation. Seung-jae, Arirang News.